Hello viewers, I am Dr. Rahul Reddy, consultant andrologist from ANDROCARE Andrology Institute, Hyderabad. Today I will be discussing on semen analysis, because most of the couples, when they have infertility problem, they go to fertility doctors, they ask for semen analysis. So now once you do semen analysis, there are so many confusions. What is important in semen analysis, how you have to give a semen sample. There are so many confusions, and most of the diagnostic centers or fertility centers, they don't concentrate on these factors. So first thing, when you go for a semen analysis report, first thing what is important is don't go to diagnostic centers, because semen analysis is a different subject and it needs a qualified technician, or they should have an advanced computer assisted semen analysis lab, or there should be a lab technician who is properly trained in this field. Not every lab technician can do semen analysis. See, because most of the diagnostic centers, they do blood tests, where they take blood, put it on a machine, they will get a report. But this is not a test like that. All these parameters have to be individually examined, and the lab technician needs expertise in this field. And second one, once semen analysis sample is given in the laboratory, it has to be examined within 40 minutes. So now they can't wait for a senior technician. Suppose if a lab has one senior technician who comes in the afternoon and you give semen analysis in the morning, then they can't wait till senior technician comes. So now as a junior technician, we don't know what is his expertise level. So always whenever you are giving semen analysis, don't give it in a diagnostic center, give it in a nearby fertility center where there is a qualified or trained andrology technician is there. So now semen analysis, first thing which is important for semen analysis test is abstinence. Abstinence means the gap between previous ejaculation and the test. So normally the gap should be 2 to 7 days or 2 to 8 days. That means if you have ejaculated in last 48 hours, generally you are not supposed to give the sample. Even it is sleep ejaculation, nocturnal ejaculation, you are not supposed to give the test. You have to wait for 2 days, 48 hours, and if the gap is more than 7 days, better avoid giving a semen analysis test. Better wait for ejaculate once again, wait for another 48 hours, and then give semen analysis test. And second is how, whenever they will hand over you a small bottle to collect semen sample, whenever you ejaculate, the entire sample is important for a semen analysis test, not a single drop or a couple of drops. Because semen, when it comes out, it comes in 3 different parts. It comes from 3 different areas. So all that semen has to be mixed. Generally, we are not supposed to do semen analysis in first 15 minutes. We have to mix it properly. All the components in the semen has to be mixed. So now even ejaculation is important, because all these 3 parts should come out properly. So whatever comes out, you have to collect in the bottle. If there is a spillage, suppose the first jet of ejaculate which comes out, if it falls down, then actually 70% of the sperms are there in the first jet of ejaculate. So if you miss that particular early ejaculate, better wait for, don't give the sample, wait for another 2 days or 3 days and give one more sample, because instead of a negative report saying abnormal semen parameter, you better wait for another 2 days, give a proper sample, because your entire treatment depends on this semen analysis test. Second thing, once semen analysis is given, what in the report we have to look for these parameters. One is semen volume, second one is pus cells, third one is viscosity or liquefaction, and there are other things like pH, all those things. They are not important, but see, these things are very important things in normal semen analysis report. So volume of the semen, so the amount of the ejaculate what is coming out is very important. It should be more than 1.5 ml. If it is less than 1.5 ml, that means, see, even if all other parameters are normal, the chance of natural pregnancy is very less. So this has to be improved. So what are the reasons for low semen volume? One is low testosterone, or any infection in the prostate, or any blockage in the ejaculatory system. So that has to be, and commonest problem for low volume is low testosterone, which can be easily corrected. And second one is presence of pus cells. So generally pus cells are not common in semen. If there are pus cells in the semen, then you have to suspect some infection. So all these pus cells, the pus cells may be coming from the urine passage, pus cells may be coming from urinary bladder. So you have to differentiate. Generally we do semen culture test when there are pus cells, and we have to find out what kind of bacteria is there, and we have to treat that. And third one is liquefaction. See, normally when semen comes out, it is in a gel form. This gel form slowly, within 15 to 30 minutes, slowly it converts to liquid form. So that is called liquefaction. So for some people with prostate infections or seminal vesicle infections, this liquefaction is delayed and their viscosity is on the higher side. So when it happens, that means there is some infection and sperm can't move freely in that viscous medium. So the chance of natural pregnancy is little less when viscous or liquefaction is delayed, or when there is high viscosity. So these things have to be noticed, because most of the times doctors, they concentrate only on these three things, but these are important, because these are minor things which can be treated easily. Once you treat, because pus cells is related to motility, if there is infection, motility will be less. If there is delayed liquefaction, again motility will be less. So these are connected. So next thing is concentration. So concentration, there are two things in semen analysis sample. One is total concentration, second one is concentration per ml. So for us, concentration per ml is important. So now concentration minimum reference value should be more than 15 millions per ml, and average, see, this is not a normal range. So WHO, the World Health Organization, has given these ranges based on their research, latest research figure statistics. So now this is like pass mark, and this is like good figures. So normally people should have more than 15 millions, and average semen concentration should be 30 to 40 millions per ml. So now what it means is, if it is in the normal this range, there are very good chances of natural pregnancy. If it is in this range, there are natural chances, but we have to improve them from this range to this range. But if it is less than this range, then that means the chance of natural pregnancy is very less. Then based on the level, then we have to decide their treatment. Coming to motility, motility means the number of sperms which are moving forward, not just moving in the same place. It is called progressive motility. So that should be more than 30%, and average value should be 40 to 50%. That means that at least in every 100 sperms, 30% of the sperm should move forward. If 40 to 50% are moving forward, then it's a good sample. And again in this, now according to new classification, there is rapid progressive motility. That means the percentage of sperms which are really moving fast, that should be more than 30%, at least 10% in this value. Coming to morphology, there is lot of confusion between morphology, because most of the diagnostic centers, they still follow 1980s guidelines where they say morphology is 80% and normal. Nowadays, according to 2010 guidelines, now there are 2020 guidelines, even 10 years old guidelines says morphology should be more than 4%. And if you are seeing any report which says morphology is more than 70% or 80%, that is a blunder. This is not common. That means that report quality is very poor. Better to repeat the sample, because sometimes what we see is, we see patients coming with 5 years, 6 years infertility history, and all their semen analysis reports normal. But when we see repeat morphology will be less than 4%. That means they have wasted almost 4-5 years time only because of the abnormal report. Because if somebody gives morphology as 70%, 80%, even the gynecologist, they think that it is normal and they stop treating him. So this has to be, that is why I say semen analysis has to be done in a fertility center, not in diagnostic center. So morphology has to be more than 4%. So simple, what it means, in every 100 sperms, at least 4 sperm should be perfect. Morphology is nothing but shape of the sperm. Sperm has a head, neck and tail. So all these three should be proper in at least 4% of sperms, and ideal range is 7 to 15%. If somebody has 7 to 8% morphology, that means it's normal. Even though 92% are abnormal, at least 8% are normal, which is totally in the normal range. So viewers, this is about semen analysis. We'll try to show some videos about how we do semen analysis, how the CASA system works, that means what is computer assisted semen analysis, because now next video I will be posting on computer assisted semen analysis, how sperm looks in a computer, all those things we will show you. Please subscribe to our channel, we will be posting on solutions for all these things. That means what has to be done when volume is less, what has to be done when concentration is less, and all other parameters. And other important thing what you have to notice is semen analysis is a just basic semen analysis test. So this does not tell us about functional aspect of the sperm. This is only a structural aspect of the sperm. So we only say how many sperms are there, how whether they are moving or not. That is what we see in semen analysis sample. But if somebody is having normal parameters, still there is infertility, then we have to do those advanced semen tests like sperm functional test, sperm DNA fragmentation index, sperm ROS estimation, all those things we will do in these people. Okay viewers, keep following us, we will be releasing videos on all these aspects. Thanks for watching, goodbye.